Hi, my name is Sandra Nemitz. I'm the Director of American Eye Surgery Center here at Georgia Center for Sight in Athens, Georgia. We'd like to welcome you and your family members to our surgery center today. We opened in 2006. We're licensed by the state of Georgia. We meet all the conditions of coverage for Medicare, Medicaid, and your insurance company. We're accredited by AAAHC, which is the Accreditation Association for Ambulatory Healthcare Surgery. We meet all the standards to provide you with the highest quality of care. What we'd like to do is give you and your family member an idea of the process that will happen to you while you're here in the surgery center. First of all, I would like to thank you and your family member for choosing our surgery center. We are so happy that you've brought a family member here with you today. It's so important for them to be here in case there's an emergency and to also listen to your discharge instructions, as that you're going to be given some sedation today and you may not remember the discharge instructions that will be given to you. The most time-consuming part is the preparation for your eye. It usually takes about 45 minutes for every eye to be dilated properly for your cataract surgery.
So once you're ready to come back to the pre-op area, we're going to place you on a stretcher. Then we will get you hooked up to our monitor, which will monitor your heart rate, your blood pressure, and your oxygen saturation. And we will verify your name and your birthday and which eye we're going to be operating on today. At that point, the nurses will proceed with your pre-op assessment, which they'll go over just our basic stuff like, did you use your drops? When was the last time you ate or drank anything? Who's here with you? Just basic information like that. They will then start a little IV in your hand or your arm, wherever they can find the best spot. It's a little tiny baby needle, so don't be afraid. It'll just be put there so that we can give you some medication in your IV to help you relax, help you just kind of stay calm and cool during the procedure. At any point you feel uncomfortable or you feel anxious, please don't hesitate to ask for more medication. We'll be glad to get that for you. Also, we'll be giving you some nice, warm, cozy blankets, and so if you're ever cold, you can also ask for another one because it does get a little chilly back here. At that point, the nurse anesthetist will come in. She'll speak with you, go over any kind of anesthesia questions you may have or sedation or anything that you may have concerns about. She'll talk with you about that. And at that point, Dr. Dong will also come by. He'll speak with you. He'll listen to your lungs and your heart, make sure you sound good today. And then he'll mark the eye that we're also going to be doing. We want to make sure that we're doing the correct eye, so we'll ask you that several times. So don't be alarmed. We just want to make sure we're all on the same page. Next, your operating room nurse will come by and speak with you. She'll review which eye we're doing again, which procedure we're doing, any allergies you may have, any injuries or surgeries you may have had with your eye at that point, and just make sure all your paperwork's in order and that you're good to go as far as your surgery. And at that point, we'll wheel you around to the operating room, where you will be greeted by your surgical technician, where we will go ahead and get your eye and your face cleaned up and ready to go. At that point, Dr. Dong will come in. He'll place a sticky drape over your eye and this little device that goes inside your eye that helps hold your eyelid open. So you don't be concerned about having to hold your eyelid open. We'll take care of that for you. And at that point, he'll sit down and he'll pull the microscope over the top of you. It'll be an extremely bright light, almost like you're looking into the sun. So don't be alarmed, just follow his directions. He may ask you to turn your head or move a certain way, just do so slowly and gently, and he'll direct you from there. At any point throughout your procedure, please do not hesitate to ask for more medication if you need to. We'll be right there with you the whole time. Just have to ask and we'll be glad to accommodate you. And once he's finished, we'll take that drape off, we'll put a patch over your eye, and you'll be wheeled back out to recovery while your family member will be waiting for you at that time.
Once you arrive in the post-op area, you will be provided with something refreshing to drink. We're also going to speak with your family member and provide them a copy of your discharge instructions. So don't worry about trying to remember everything. It will all be written down for you and you'll receive a copy to take home with you. Because of the medicines you've been given today, it is illegal for you to drive. So do not drive or operate any machinery for the next 24 hours. Light to normal activity is fine for today. We do not want you to strain in any kind of way for the next week. You may bend over, but just no real heavy lifting or straining for 1 week. It's normal for your eye to itch and feel scratchy. Minor discomfort is expected. You may take anything over the counter, Tylenol, Motrin, Aleve, whatever you prefer that you take at home for minor discomfort. If you've missed any of your normal medications, please resume those as well. You will have a patch over your eye. Please keep this in place. Do not remove it. The doctor will take it off the next day at your post-op visit to check your eye. Please do not put any pressure on your eye as well. Now, there are 3 things that we do want you to be watchful for. If you have fever or if all of a sudden you lose loss of vision in the eye that we've operated on, or if you have pain that is severe in nature, that's not relieved by something over the counter that we've recommended, we do want you to call us. This is very important. Your post-op appointment will be listed on the piece of paper that we're sending home with you today. The date, the location, and the time of your appointment with your doctor. Make sure that you gather all your eye drops that you have, bring those with you so that we can give you further instructions on how to use them.
Again, I want to thank you for choosing American Eye Surgery Center at Georgia Center for Sight. We look forward to a successful surgery and much improved vision for you in the future.